Early in the epidemic, when community transmission was low, remember, we were focusing on lockdowns, stay at home. Why? Because we wanted to prevent people from getting exposed to the virus in public. Now, the virus is very common in the environment, so maybe stay at home is not as effective. What we need to focus on are the interventions to prevent infection. If you're out there and the virus is out there, what can you do to prevent it from getting into your body? So vaccination is very key, and boosters very key, but also masking, physical distancing, and ventilation, air supply. If you still get infected despite doing all that, then you go to the next phase. It's what can you do to prevent yourself from getting severely ill and having to get into the hospital. And at that point, vaccination still has a big role, but also your monoclonal antibodies and the antivirals that we have, the Paxlovid, Molnupiravir, and now remdesivir is also being used for that. And then if unfortunately, despite that, you still end up in the hospital, then to prevent death, you have to have the ICU care. So at each point, there are different things that you can do. But I think the takeaway message is that we have now all these different interventions that we can use, which we never had in 2020, right? We didn't have the vaccine back then. We didn't have the antivirals. We didn't have the monoclonal antibodies back then. We have them now. But we have to take action. So us, as individuals, we have to proactively wear our mask. We have to proactively go for our vaccines and our boosters. If we do get symptoms, we have to proactively get tested so we know if we're infected or not. And if we are testing positive and we are older, like myself, or we have chronic illnesses, then we have to speak to our physicians so that they can determine if monoclonal antibodies or the antivirals can help. So that's the continuum: exposure, infection, severe disease, hospitalization, and death. So at every point, there's something we can do. And it's important to get that message out.